Um, we will also hear from persons in the community, from civil society organization, etc. And we want it to be an interactive session where you're able to share your experiences, you're able to share what are the challenges, and we're able to take these into consideration and look for strategies to push the use, the implementation, the scaling up in places where it's available, and the rollout of PrEP in places where it's not being used, so that we can approach and embrace these new interventions as we move forward. So I thank you very much. Thanks to everyone. Xavier, thanks for facilitating, and thanks to the knowledge management team at PANCAP for putting on another virtual chef here. We know that we're operating in the COVID-19 era and we cannot meet face to face, but the dissemination and having these types of sharing of information session is very critical as we move forward and as we try to end AIDS in the Caribbean. So thank you very much, Xavier, and welcome everyone. Over.
Thank you very much, Dr. Adams. Now, we have an exciting agenda lined up for you today, and we have experts in the delivery of PrEP, both at the civil society level and the government level, here to bring you their experiences today. Now, one of the most interesting part about the presenters is that they're going to be representing the experiences from the first two countries in the English-speaking Caribbean who brought PrEP. And so they, as countries, have more than 3 years experience delivering PrEP to the citizens of their respective countries. If you check your agenda on screen, you'll see that right now we want to go through our expectations for today. But there are a couple of housekeeping things that I want to kind of just bring to your attention. We recommend that persons keep their microphones muted during the sessions. If they have a question during any of the discussions, you can use the raise hand feature, or you can ask your comments in the chat box. Now, because we know that sometimes several persons are joining from one machine, we are asking you as well to, in the comment box, write your name, your organization, and your position, so we could get a sense of all the persons who are represented here today. Now, for the expectations, there will be an expectation board that will pop up on your screen shortly. Sorry, that link is posted for the expectation board is posted in the chat bar. Please select the link and it will allow you to post your expectations. But in the meantime, let me share with you 4 specific objectives that we, the PANCAP Technical Working Group for Knowledge Management, intends on bringing to you today. So the first objective that we want to bring to you is we want to facilitate participants' understanding of the role of national AIDS programs and civil society organizations in the design, implementation, monitoring of PrEP programs. We also want to enable participants to understand the factors that facilitate successful design, implementation, and monitoring of PrEP programs, as well as the challenges and how these were addressed in the Bahamas and Barbados. As a third objective, we want to identify lessons learned in the design, implementation, and monitoring of PrEP programs in the Bahamas and Barbados, and how these can be applied to different countries. And finally, we want to understand the critical elements to document and publish implementation experiences. So those are our objectives for you this morning. And so we wanted to get a sense of what were your own expectations from today's session. So if you look in the chat box, there is a link posted by Dr. Singer Anthony that you are able to click onto, and it will allow you to write your expectations. We want to do this for about 5 minutes. I'll read a few of them for you, and then we will move into the rest of the morning. So go ahead and click the link.
Hi, good morning, Xavier.
Sure.
Hi, just to add that it will take you to the Padlet that you're seeing on the screen. At the bottom right corner of the Padlet, there's a pink circle with a plus. You click on that, awesome. It allows you to write your expectations in. Thank you.
Thank you so much for that, Dr. Anthony. Remember to access the Padlet. Please find Dr. Singh Anthony's name in the chat bar. She has posted a link that allows you to post your expectations. So already I am seeing increased understanding of countries' challenges to implementation as an expectation. I'm also seeing learning more about PrEP, working in other countries. I'm sorry, let me just zoom my screen so that I could read that correctly for you. So learning more about how PrEP is working in other countries, and if there's anything we can use in our own programs to share and hopefully inspire others to make PrEP become more widely available. If you are just joining us, to participate in our expectation wall, please see the link posted by Dr. Singh Anthony in the chat bar. You can use that to write your expectations for today. Other expectations are to understand how other countries in the Caribbean were successfully able to implement PrEP. I hope the share fair will fully highlight I hope the share fair truly highlights the necessity of CSOs in successful program execution. We still see the expectations coming in. We'll do that for another 2 minutes or so. We also want to hear a little bit about, we want to understand the various challenges other countries may have faced and the way forward. We expect to hear a little bit about the realities of implementation. We are aware of the positives, but what are the challenges currently faced by other countries? Okay. Could you expand that one to me, Dr. Singh, to be able to better understand our role in, not seeing that one so clearly. Okay. So of the expectations that are on screen, we will bring them back to you later on this morning to pretty much get a sense of how much of these expectations we've been able to satisfy for you. We're going to now move to Dr. Singh Anthony, who will walk us through what exactly is a knowledge cafe. And afterwards, I'll come back and tell you what the breakouts for this morning will look like. Dr. Singh?
Yes, thank you so very much, Xavier. Good morning, everyone. I will quickly go through a few slides on what is a knowledge cafe, so that we can have the context as we go into our breakout rooms and into the knowledge cafe. It's really, for those of you who have been to PANCAP's knowledge events prior to this one, you would have been exposed to knowledge cafes. But what it is, it's a means of bringing people together for a respectful, open, honest, and creative conversation on a topic of mutual interest. In this instance, we're talking about PrEP, to share ideas and to get a better understanding of the issue. Next slide. The objectives of any knowledge cafe and of our knowledge cafes today would be to surface collective knowledge. And so as our presenters will be sharing their experiences in the Bahamas and in Barbados, the idea is that the knowledge that comes out of a knowledge cafe should be collective. So the request of you to really participate, share your own experiences, share your own challenges. You may not have a up and running PrEP program that's well established. For example, when you hear of the Bahamas experience or Barbados experience, may not be established at the same level, but you have experiences that you can share. And so Knowledge Cafe really is to share collective knowledge. It's to enable participants to get a better understanding of a complex issue, to get a better understanding of other people's experiences and perspectives. And again, as we're hearing from the presenters, it is for you to also share. As you're sharing in knowledge cafes, the idea is that you may be able to get a better understanding of your own views and your own perspective of the specific issues. Because I think oftentimes when we articulate issues, we come to the realization as we're articulating these issues that I have a better understanding of the issue. And so again, here is a request for you to participate. The Knowledge Cafe is really to ventilate and explore any contentious issues. So while we're talking about PrEP, please feel free to put on the table some of the challenges that you're facing, some of the issues that you've had to deal with as you're going through the process of getting into PrEP implementation, whether it's moving from policies to collaboration with different stakeholders, being able to ventilate and explore those issues as a group, as a small group that's in this cafe, and really being able to operate within the context of this being a safe space. It is to build consensus on the specific issue. And in everything that we do at PANCAP, we want to be able to facilitate networking among our different stakeholders. What will a Knowledge Cafe do for you? And in this case, what will this PrEP Knowledge Cafe do for you as participants? It is intended to crystallize your own knowledge, and in this case on PrEP. You may find as you're articulating your positions and your perspective and your experiences, and as you're hearing from others, that you will find that your thinking on the specific issue, and in this case on PrEP, may evolve, and that's a good thing. And as you're listening and as you're speaking, you will also get new ideas, and it could possibly bring to you a fresh perspective as to how you think or you rethink PrEP. Next slide. So why we are doing a Knowledge Cafe, and as Xavier said, we're doing this for the first time virtually, but we've done Knowledge Cafes before. It's sort of an informal setting. It's supposed to be relaxing, it's supposed to be fun, it's supposed to be creative, be able to have that collaboration and networking, non-threatening, but it's time bound. And so we'll be timing each Knowledge Cafe. Each cafe will last for 30 minutes, and I'll go into that. It is really a conversation, and in real life, if we're to do this in person, it'd be great to be sitting around a table with a cup of coffee, really having this informal, relaxing conversation that is supposed to generate new ideas and bring fresh perspectives. It is a safe space, and everyone should participate, listen, but also contribute. So what are the outcomes of a Knowledge Cafe? The real outcome is what you take away from it. But the idea is that there could be new connections that form. You will have a deeper understanding of the issues and other participants' experiences and perspective. a better appreciation of your own point of view, a better understanding of what you know of the issue and what you don't know. But I think the bottom line at the end of all of this, it should put you in a position that will allow you to make informed decision. And in this instance on PrEP. This morning, we have two knowledge cafes. We have Dr. Nikia Forbes, who is the director of the National HIV/AIDS and Infectious Disease Program in the Bahamas. She will present on their PrEP program from a national government perspective or experience. And we have Dr. Nastasia Rambaran, a public health consultant, researcher, and physician from a civil society in Barbados, Equal Barbados, who will present on the CSO experience. Next slide. So for the knowledge cafes, there are 2 rounds of knowledge cafe, and each round will last for 30 minutes. Everyone will participate in both cafes, so you'll get an opportunity to be with Dr. Forbes and to be with Dr. Rambaran. You will receive shortly, once Xavier launches the Knowledge Cafe, you will receive an invitation to join a room that will pop up on your computer. Please accept the invitation. You will remain in the same room for both cafes. After the first round of the cafe, we will switch the presenters. So the only person who will be moving from one virtual room to the next will be the presenters. All other participants will remain in the same room. During the cafe session, you'll be given 2 notices, a 5 minutes countdown. So at 25-minute point, we will send a notice to you to say that you have 5 minutes left. And then there'll be a 1 minute to wrap up, after which presenters will change. And at the end of the cafes, everyone will be redirected to plenary. So over to you, Xavier.
Thank you so much for that, Dr. Singh Anthony. Okay, now one of the difficult parts about working in virtual environments is once we set these timers, they will discontinue your discussions, sometimes even mid-sentence. And so we encourage as best as possible when you see the 5-minute and 1-minute wrap-up reminders that you try to close out the thoughts that you were making so that everyone gets to experience or the benefit of the experience in that conversation. Now, as Dr. Singh Anthony also alluded to, we have 2 excellent presenters who are going to be guiding us through the Knowledge Cafes this morning. The first is Dr. Nikia Forbes, who is the Director of National HIV and AIDS and Infectious Disease Program in the Bahamas. She is a consultant in infectious disease at the Princess Margaret Hospital and Doctors Hospital, as well as an associate lecturer at the University of West Indies School of Clinical Medicine and Research in the Bahamas. Dr. Rambaran is a Guyanese researcher, writer, activist, public health consultant, and physician living in Barbados. She received her medical degree from the University of Guyana School of Medicine and has a master's in public health from the University of London, London School of Hygiene and Tropical Medicine, and a postgrad certificate in LGBT health policy and practice from the George Washington University. Dr. Rambaran is currently finishing her first year as a PhD student with the University of Glasgow, researching queer activism in Barbados and Guyana, and has a passionate interest in LGBT health, HIV, gender justice, decolonization, and human rights. So as you would have realized, both presenters are very competent, they're very versed in their field, and they'll be bringing their experiences to you. So participants are going to be randomly assigned to a room, as Dr. Singh said. When you see the invitation pop up on screen, please accept that invitation. That process begins in another minute or so. And at that point, once your presenter is assigned, your first 30 minutes will begin. So let's get that process going.
Hi, morning, Timothy. Hello, Anita. Hi, Rosman, Shanti. Nikia here. You might need to move me to the Bahamas room because when I left the room, I ended up in the Barbados room.
Okay, let me move you over. It really doesn't matter though, you know, Nikia, you can present once you and Nastasia are not in the same room.
Okay, then. Okay.
Okay,
I'll try again.
okay.
Now it says leave meeting. I'll just stay where I am for now because I see there are a few persons.
Okay, so Nikia, you're not in a room, are you?
No, I'm still in the main room.
You're still in the main room. Let me send you to Barbados room because Nastasia is in. Okay, I'm gonna move you to the Bahamas because you're supposed to be in Barbados. I'm moving you to the Bahamas.
Okay.
Let me move Nastasia over to Barbados. Okay.
Shanti, that was the Barbados room.
That was the
Because
Barbados room?
was starting to speak.
Gee. Okay, so I need to move you to which room?
The room that I just entered just now?
Yeah, because you're
Yeah.
already, you're in the Bahamas room for some reason. I don't know, I see that you're in the Bahamas room, but it says that you haven't joined. Do you have an invitation for the Bahamas room?
No.
Oh, let's see.
Sorry about the technical difficulties.
I know. And Dr. Rambaran has started hers, right?
I think so. She was starting to speak when I entered that room.
Yeah, I don't want to interrupt her. Is it possible that you can log in again, Nikia?
Yeah, I can leave and log in again. Sure.
Great, yeah. Hi. Uh-huh. She disappeared. Okay, hold on. I don't know where she is.
Do you want me to join the Bahamas?
Hold on, let me see. Where is, we lost Nastasia for some reason. Okay, Nikia, yeah, join the Bahamas, Nastasia. Nikia, join the Bahamas.
Good morning, Ms. Shanti.
Hi.
This is Trinidad from
Let
Ministry
me
of
send you to a room. Where are you from?
Trinidad and Tobago.
Okay, I'm sending you to the Bahamas room.
Okay, sure.
Hey Shanti, it's Clement. Can you send me to the Bahamas room? I would like to hear what they are doing in the Bahamas.
Okay, so where are you, Clement? Hold on.
I was in the Barbados, but I left the room.
Okay, 1 second. Let me send some other people out. I'll send you out over quickly.
Yeah, thanks.
1 second. So you want to go to
Bahamas.
1 second, come on.
Okay.
There. I'm not seeing you as unassigned. Okay, hold on. You want to go to the Bahamas? Oh, gee, I sent you off somewhere. Hold on. So for everyone else who is in the large room, could you please accept the invitation and join the breakout rooms? Thank you. So good morning again for persons who are in this room. You would have received an invitation to join one of the breakout rooms. Please accept the invitation. Accept the invitation to join the breakout room. If you haven't, let me know, please. Thank you. Hi, Tariq.
Hi, my internet dropped. Please send me back to the Bahamas.
Oh, okay.
Breakout session.
All right. Okay, good. What Hi, Ms. Jennifer Joseph. You would have received an invitation to join the Bahamas room. Please accept.
Hey, I'm back. Sorry.
Nikia is in
Bahamas.
Bahamas. I'm gonna move her to Barbados. And let me send you to,
Send me to the Bahamas. Yes, thank you.
yeah, I'm sending you to the Bahamas. 1 second. But you're not here. Move to the Bahamas.
All right, good, cool. Got it.
Are you there? Oh dear. Hi, Clemon.
Yeah, hi Shanti. I gotta leave, so I'll join back with you and talk to you another time.
Okay, great. Thank you.
Okay, thanks.
Thanks for joining.
Yeah, thanks.
Hi, Milton. Good morning. Hi. Milton?
Hi, good morning.
Hi, you should have gotten an invitation to join a room. Just accept the invitation.
It just went off. I was not getting connected, so I rejoined just now.
Okay, but yeah, you should, but you have an invitation right now with you to join a room. So just accept.
Finally, on the more,
Huh?
where will I find that?
Did you get something pop up on your screen?
Come up. I didn't see it because now I rejoined.
Okay, so let me see. Milton. Yeah, I sent it to you, but let me see if I can send you to the Bahamas. Did you get another invitation?
Yes.
Okay, go ahead. Accept it. Hi, Dr. Tariq. Where should I send you? You're on mute. Hi, Sandra. Hi, Sandra.
Yes, no, sorry, I came out because I had to go make a call to Guyana. Yeah.
Okay. I see you're sending emails at the same time.
Yes, 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 yes. And I need to get this training going for Guyana. Yeah, I will just use my own. Yeah, we will just go ahead with this. I can't take this into 2022, and this is how. Yeah, I have too much things, and this is just this is not working. This is not working. So
Okay.
I will forward you an email.
Let me send Dale to a room. Dale has just got in. Let me send Dale to a room. I send her to Barbados. Let me assign Kenny to a room. I'll be right with you. Yeah.
Check your email, your personal.
Okay. Let me send a message. My Gmail? Okay.
Yeah. I'm organizing this training for Belize.
Let me send them a message to the room. They have 5 minutes left.
What is Natasha's last name again?
She's Nastasia Rambaran.
Ram. I was trying to see if I have it in my email. I should have her email.
You should have it. I'll send it to you if you don't, but you should have.
It's not coming up. NATASS. Oh. Yeah.
Let me see if Timothy got the message in the rooms.
You go ahead and do what you need to do. Don't worry about me.
You stay on, keep talking. I'm listening to you.
Yeah. Both Nikia's and Natasha's. Oh, there it is from Baran. Both Nikia's and Natasha's presentations were excellent. I like Natasha's.
Did you get a 5-minute notice? Okay. Okay, great. Thank you. Thank you. Good. Bye.
I'm going to copy you. I like Natasha's presentation because I think for a country like Belize that is excluding CSOs, I think it's going to be pertinent.
Yeah, no, I think Equals, Anton and Equals did a fantastic job in Barbados. It's a small country and they've managed it nicely. It's a really nice program that they have. The good thing with Equals is that Nastasia actually is a physician and she sees the patients there, right?
Right.
Yeah.
Yeah, so, and this is the reason why Belize Family Life Association can do this.
The place to do it.
But the ministry just don't want them. They tell them they have to have a pharmacy. And you see, and I keep telling them they have so many pharmacies in Belize. They could say this one pharmacy is the pharmacy that will dispense the ARVs. Do you understand me? They don't have to have a pharmacy.
Yeah.
So yeah, I'm copying.
I think we are being recorded, but that's okay.
Yeah. Yeah.
So we'll have to edit all of this out.
Yeah, sorry, but it's our planning.
Yeah. You got her email?
Yes, I got it.
Perfect. Yeah.
Yeah.
So you think she would be able to share with Belize?
Yeah. Yeah, I think it's going to, I'm writing them now. I know Nikia has agreed already. Verbally to me. So I'm just writing because she said she could adjust her presentation for Belize. I'm writing them. I'm copying Edwin and Joe from the Belize country office. And once they agree, we could have a quick meeting and then I could link them with the Ministry of Health people. Not Dr. Murray, but the person who is in charge of this training. And because there are some physicians right now who want some information. So I said we could do this sensitization with them from Nastasia and Nikia Forbes. And this is one of the things I want to set up with Omar, a date where we could do the training for Belize. I write to Alexander and ask him to find out from Dr. Jean Lorraine when he wants to do the training. I just have to move. I can't do this anymore. So this is what we're going to do. I'm just going to get dates because we're already in July, and before you know it, and I can't take this over to 2022. I have too much to do.
August is, I mean, now it's COVID, but generally August, people have their children at home. It's vacation. You somehow get into that vacation mode, you know?
And then after that, and then when you see, after October, it's hard to get things done.
It is very difficult. Very difficult. 1 minute left. Please wrap up. Okay, I think people are coming back out of the rooms.
Okay.
Maybe they're finished.
Let me mute my, I'll mute now, yeah?
Okay, good.
as persons return from the various breakout rooms, we'll allow another few seconds for that to happen. I must admit that I am truly excited about what the technology allows us to do, despite the limitations that COVID would have created for us. I am particularly grateful to the team at PANCAP, and in particular the Knowledge Management Technical Working Group, who continues to make these sessions available for us to continue to participate in, despite the ongoing COVID challenges. So I see that most of the participants are back, and so I'm going to open the plenary space for about 5 minutes or so. We could have quick discussion on some of the thoughts and ideas that we would have heard in our own breakout rooms just now. Thank you so much to Dr. Rambran and Dr. Forbes for very competently leading us through the knowledge cafes as they did just now. So I'm going to open the floor real quick for any thoughts or lasting impressions that people may have coming out of the knowledge cafes that they thought they wanted to air in a wider space. If you are familiar with the raise hand feature, please use that. If not, you can open mic and I'll acknowledge. Okay. I know the facilitators were very competent, and they did their absolute best to bring the information to us. So let me start with a question that I ended the last cafe with, maybe to get the plenary session going. Dr. Forbes, this question is for you. In listening to the CSO experience, there was for the CSO, there is a spike in uptake, and then it plateaued a little bit after a while. But with the Ministry of Health and Wellness in your country, it started slow and picked up over time. What do you think accounts for the differences in those two experiences?
That's a great question, Xavier. So for us, we knew that we had to start, and so we started to offer it through our clinic, while we had ongoing trainings and partnerships that were being established to CSOs. And we were using other platforms like social media, our partnership with the media, to raise awareness about this. So I think it took a while for people to be aware and fully know that this service was available and where they could get it. And it took time for our providers to get comfortable. And it has been gaining traction. It's been improving year upon year. And I think that was what accounted for our experience. So I think that's why ours is going up over time.
Okay, awesome, thank you. Whilst you're still here, and I'll ask Dr. Rambran to jump in after, you did talk about 100% government commitment when you presented the information as to why PrEP would have been a good prevention product to introduce. Was that a short process? Was it a tedious process? Did you have to do a lot of sensitization, or were they just ready?
I would have to say that I was lucky. I had a minister who does what I do, who does, it's good, you know, it's always good for technical people who have to write policies when you have the buy-in of your administrators and policymakers, because sometimes that's something we have to learn to do when there are policymakers who have extrinsic biases. And I've come across some of those in our region who say, no, I don't believe in PrEP. I think that PrEP is going to cause, what's the word? Promiscuity. And you know, I'm a big proponent of being comfortable talking about sex and the human experience. And so we've got to remember that this is a proven prevention modality. It's been around for a long time. And our role is to provide protection, care, and prevention services for persons, not to judge people in their life and choices. And so, no, I didn't have any problems. And so that was good. And so I jumped on that at the right time and said, okay, this is something we will do. We will implement that. But good luck to persons who are having challenges. Maybe we could have an offline conversation because there are ways to persuade them.
Definitely, definitely. Thank you so much. Dr. Rambrand, do you want to weigh in on that one before we move to a question or a set of questions from Rima?
No, just quickly, as I said in the presentation, we had that support. The ministry was on board. I think it's because of the stewardship of Dr. Best, who was convinced from the beginning and managed to convince everybody else in the ministry about the necessity. And then some of the doctors other doctors in the country were initially hesitant. They came on board after they saw, I guess, that PrEP didn't lead to the apocalypse, essentially. So yeah.
I get you. All right. So for persons who don't want to open mic, you can ask your question in the chat box. I have a question or a set of questions here from Rima Lewis. It says, how do you manage stockouts and shortages in ARV or lab reagents? And are PrEP clients reprioritized? So Dr. Rambrand, you could go take that, and then we take Dr. Forbes.
That's a very good question. We actually had that where it was a battle between patients on treatment with Truvada and our PrEP patients who needed it. Fortunately, it didn't come down to like a decision between the two of them, as in, oh, you can't give any more PrEP because we don't. Actually, it did, but people had PrEP during that process, so thank God. But yes, you're right. It kind of had to be reprioritized. So what we did is we prioritized our high-risk patients. So the patients, as I said, who had multiple partners, weren't going to use condoms, and it was essential that they stayed on PrEP. So that was the reprioritization that we did.
Thank you. Forbes?
Great question. So we did not have that problem before COVID. So we made sure that we had enough of tenofovir and emtricitabine for both treatment and prevention before COVID. But with the supply chain issues with COVID, that did get to be a real problem. And so you have to remember, well, first of all, there are other medicines that can be used for PrEP that have been studied, like tenofovir alone, for example. If push came to shove, you could do that. But this is what you have to remember in the face of stockouts with your PrEP clients. You can't just stop PrEP. Remember, if you're not having protected sex, so your partner, you're in a discordant relationship, if you're gonna stop PrEP, you've got to taper off of it and use condoms for a certain period of time, some weeks, right? And so it's a human rights issue. If you're giving people PrEP, you can't just stop tomorrow because they could seroconvert to HIV positive. And so you have to prioritize your PrEP medicines for PrEP. You can probably think of other regimens you can use for some clients for treatment in the face of a stockout, but it's not really a situation you want to be in. One of the key things about planning for PrEP is that you've got to think about supply chain management. You've probably got to project about how many patients you're going to be starting on PrEP and look at your stock management. But if you end up in that unfortunate situation, that's how you would have to deal with it.
Thank you. Thank you so much, Dr. Forbes. All right, so I'm going to take the last one from Monique. Please open mic and go ahead.
Thank you. My question is, if the PrEP surface package is part of existing health insurance schemes, and if not, are there plans to integrate it in an existing health insurance scheme, and are there any challenges in doing so? Thank you.
Before you answer that one, I want to add another question in the chat bar from Dr. Jennifer Tomlinson that's asked, have you noticed a significant increase in STI in patients on PrEP? You could take both, and then we round this piece out.
You want me to answer first? Okay. So it just happens that antiretroviral therapy and HIV treatment, care, prevention, the whole package is free in our country. And so that sort of diffused the need to have the medicines introduced in an insurance package that insurance would cover. All ARVs are free anyway. Now, people decide where they want to go. Some people would rather go to a trusted private provider. They would pay the provider consultation fees, which could be covered by their insurance. There's an insurance code for that. And they could pay reduced fees. Now, HIV services are also in our national health insurance, which is a move toward universal health coverage that's been around for about the last 5 years. And so, yes, that is like HIV testing, STI testing, and the full gamut of tests you would need to order for people on PrEP are included in those universal health services for patients who are enrolled in that service. So that was good. I do think that if your country is not in a position where that is the situation, you should advocate for it to be a part of insurance services because it's very cost effective. And why wouldn't it be? If oral contraceptive pills or anything else are provided through health insurance, why shouldn't PrEP be? No, I didn't notice an increase in STIs in my patients on PrEP. In fact, PrEP patients are very diligent. They come back for their follow-ups. They're going to make sure that you do the HIV and STI test. And in the PrEP studies, like Dr. Rambaran was saying, it didn't lead to the apocalypse. It didn't cause a huge spike in STIs in all of those PrEP studies, and we have had a similar experience.
Okay, thank you so much. Dr. Rambaran, do you have any feedback to add to those set of questions?
Yeah, sure. I think Dr. Forbes answered the first question, is the best person to answer the first question. But just to add that, yes, we didn't see any increase in STIs. But what is important, and this is why PrEP is such a great complement to HIV prevention services, is that when you enroll people on PrEP, you find STIs. So people, I think in this published study, we only found like 6 new STIs during continuation, but at the beginning, it's something like almost 20% of people had STIs when they came in. So it's a good way to pick up the STIs and make sure that they get treated. So people are worried about STI use because people stop using condoms during PrEP, but they forget that you're gonna pick up people that might not have come in for STI testing in any case, and those are the new people that you're gonna capture when you provide PrEP.
Thank you so much for that. All right, so Martha has a question. I'll take this one as the last one, and I'm going to reword it a little bit I hope you'll allow me to do that so that we respond to a concern that people would have had over time. So I'm rephrasing it to say, have you had an experience where any person enrolled on PrEP later became HIV positive, and how has that been managed?
So maybe I can go first. We did have 2 experiences with people becoming positive on PrEP. Both people were not on PrEP at the time. That is the problem. So the first one had actually been lost to follow-up for a year while they had started on PrEP. And by the time we got to them to say, you should restart, and they got tested, they were positive. So that is why it's so important that you follow up, especially your high-risk patients, because this person was a high-risk patient. And the second person who seroconverted, it's because they said they wanted to come off of PrEP because they settled down with a partner. Unfortunately, that partner was not truthful with them as to what they were doing, and they seroconverted. But they were both off PrEP, so nobody has become positive or seroconverted while on PrEP.
Thank you so much. Okay, so we have a close-up that's going to be coming very soon. And so I'm going to allow Dr. Rambaran to kind of refresh yourself real quickly because you're up next for that presentation. Dr. Forbes, I did say that was the last one, but I'm seeing Lester Guy asking about pill fatigue or even persons who may have broken out from discordant couples. How are they being weaned off? Can you take that one for us?
So in my experience, it's not really pill fatigue. So there are persons that are retained on PrEP, and they've been on PrEP for at least 20 months or longer. But we do have a large proportion of clients who only get their first supply and then say it's not for them after they've tried it. And some of the reasons expressed have been, oh, it's just, there could be side effects. I don't think I need to take it every day. I think my risk is low. I'll stick to condoms and lubricants. I don't really need it every day because it was just a hookup. So pill fatigue is not really an issue. And for those clients that are retained on it, they haven't expressed any pill fatigue. And then I see there's a second part. Are there those, how do you wean it off? Oh, there's a way to wean it off. It takes about 14 days or so where you last for an overlap of condoms and no new exposures, and then they can stop it after a certain period of days. I'll send it to you, Lester, after the meeting in a guideline.
Okay, awesome. Thank you so much for those presentations, Dr. Forbes and Dr. Rembrandt. We again at PANCAP remain committed to bringing you the best experiences that are available across the region. And so again, thanks for facilitating those activity or that set of share knowledge cafes for us. All right, so Dr. Rembrandt is going to be coming back to us again for about 15 minutes or so to tell us a little bit about what it takes to become published. Dr. Rembrandt, please forgive me. I know I have you talking a lot, but please jump into it.
Sorry, everybody. I know y'all probably fed up hearing my voice. I'm gonna try and turn on the screen for this one. I don't know if you can see me because I've got it minimized, but yes. So what does it take to become published? I've had a fondness for research since my fourth form social studies project that was nurtured during medical school and the mandatory research projects in years 2 and 5. Publishing at that time was discussed, but nobody I knew had published. We presented studies at conferences like CHRC, which is now CARFA, and this conference published abstracts in the West Indian Medical Journal. This journal has unfortunately since become defunct. My first academic publishing experience was after finishing my master's thesis. A colleague reached out to advertise a special edition on LGBTQ+ health in the Caribbean, and since the thesis and another study I had done just wrapped up fit the criteria, I submitted them. This was a good introduction to the process because we knew early on that our articles would be accepted. It was just a matter of patience and responding to editorial review and input. So how can you get published? Well, first, I want to expand what we see as publishing. People tend to think of academic journals as the be-all of publishing, but this is definitely not the case. Submitting to academic journals is a time and energy-intensive process that is not suited to everyone. We all have day jobs that don't leave much room for this. We're also all doing very valuable work that deserves to be documented and shared. Here, I applaud PANCAP for their efforts in highlighting regional work around HIV. That might be the first place you could consider actually, whether it's something smaller like the newsletter submission, which is only a paragraph or two, or asking for a larger 1 or 2 page feature. I can't tell you how many times in doing literature reviews or putting together background information that I found the PANCAP website helpful. Also for consideration is publishing your project or study or process on your organization's social media page. If it was a funded project, maybe the funder can host the results on their page. Another option is releasing the information in a press release and have the newspapers do the publishing for you. This avenue is a bit tricky because sometimes they print misleading headlines or information for the clicks. But if your organization has a good relationship with press outlets or journalists and the project was noteworthy, this is a great option. Academia.edu is a website that allows you to upload a variety of articles to your profile. One of my most successful articles on there is just a random paper I wrote for a class on lesbian sexual health. It's a good choice if you don't have an online organizational presence or if it's something you prefer to do as an individual. Academia also offers a very fast, very simple, and easy to use peer-reviewed option called Academia Letters. Submission to letters are short, only 800 to 1600 words, and they get accepted within a month or two after being peer-reviewed by several people. I really like the idea behind it and how easy and equitable it makes the process. You can also look for special calls in regional or international journals, and these calls usually have people dedicated to them who are willing to hold your hand a bit during the process. Finally, we can discuss peer-reviewed journals. Some things to be aware of. Most of the famous or high-impact journals have very high rejection rates. They're also biased towards global north countries or research that addresses a large population, which is not most Caribbean countries. Some of them also publish open access, and that means paying. These article processing charges, or APCs, can range from about $500 for a lesser known journal to thousands of dollars, which is the norm. The vast majority of peer-reviewed journals require a statement about ethics approval. So if your study involved talking to people and you did not have an IRB approval, your chances of being accepted by one are extremely slim. However, if you're submitting about the process, like setting up a clinic or adjusting to COVID or something like that, or you're doing a review of literature out there, you don't need IRB approval. Not all journals accept these types of articles, but at least your chances are fair. Next, find a journal that is subscription. This means you don't have to pay an APC. Often they'll give you the option to pay and publish open access, but it's not necessary. Publishing in these journals doesn't mean your article is hidden away behind a paywall, because they give you a link for around 50 free downloads that you can share when you advertise your publication. And of course, you could always email people a downloaded PDF copy. Have lots of patience during the process, as response time is usually in months, and it takes about 6 months to a year before publication occurs. Search for journals that have published similar studies or studies from your country or the region, as this increases your chances right off the bat. I like the PAHO Public Health Journal because it has a great reputation and it does not charge an APC, even though it's open access. So in conclusion, there are many routes to publishing. The important thing is to get the work out there so that we can inspire others, contribute to the evidence base, and better coordinate for the fights we fight.
Thank you so much for that, Dr. Rambran, and congratulations on your most recent publishings.
Thank you.
And Dr. Bess, your experience will be useful in guiding some of us who need to take a very similar path. Okay, awesome. So we brought you a package of interventions today for you to experience a little bit of what's happening with PrEP in the region. And so I want us to go back to our initial expectation board and take a look at some of the things we wanted to realize from this section at the beginning and get a sense if people have or people believe they have these expectations have been met. But just before we do that, I want to ask persons, if you've so far not written your name, organization, and position in the chat box, please do so before we wrap up today. Also, if multiple persons are using a machine or a Zoom account, please send your email address to, let me double check that again. Please send your email address to, let me tell you which of the emails to use, my bad. Timothy, could you help me with this one? Where do we want folks to send their emails?
They can write it in the chat as well, Xavier.
They could write it in the chat as well? Okay,
Yeah.
Awesome. Thank you so much. Thank you. All right, so let's go to the review of the expression board. All right, so at the start of the meeting, there were a few expectations that people had. I know I've seen the responses to a few of them. Let's see if we've been able to respond to the bulk of them. Shanti, do you want to guide us through this bit, please?
Yeah, thank you, Xavier. So what I did is I just tidied the board a little bit so that all of the expectations are separate. They have their own boxes. But we can start. So the first expectation on increasing my understanding of PrEP. So we had a number of expectations that were quite similar. I have not been in the knowledge cafes, but I trust that there has been an increased understanding of PrEP. So let me go ahead. What I'll do is I'll go ahead and highlight the ones that speaks to understanding in green so that we can make notes that we have achieved those.
Perfect. Let's do that.
Okay, great.
And we could cheat the system too. If everyone agrees that there's been a better understanding for PrEP, they could do a quick raise hand as well.
Oh, perfect. Thank you.
If you believe the objective for increasing the understanding of PrEP has been met, please use the raise hand feature. You do so by selecting reactions and raising your hand. Great, I see a few hands going up. Awesome. So I think it's safe to say we have met that one, Dr. Singh. You can lower your hands, move on to the next.
So the next one is understanding the realities of PrEP implementation and some of the challenges countries have faced.
Okay. I've heard, if you raise your hand if you agree with that one. Okay. See a number of hands are raised. Awesome, new hands too. So I think we can color that set in green.
Yeah. The next one, Xavier, is learning about how to better monitor PrEP.
1 second. So let's get everyone to lower their hands first if you answered the previous questions. Denise and Desiree could do it. Perfect. All right, go ahead now, Shanti, the new one.
Right. So the next one is a better understanding of how to monitor PrEP.
Better understanding of how to monitor PrEP. All right. I'm seeing a few hands for that one, but I'm getting the impression that this one has the most gaps. So can we color this one in orange, please?
Sure, just there.
I didn't get the impression that persons were as excited about that particular one. Okay, thank you. Lower your hands.
Yeah, the next one is understanding how CSOs can be involved.
Understanding how CSOs can be involved.
And the importance of CSO in the execution of PrEP.
Okay, please raise your hand if that objective has been met. Yes, that one seems to be pretty popular too. We can go ahead and color that in green.
And then the next one is understanding PrEP as a tool for HIV prevention.
Okay. Raise your hands if we've met that one. Yes, I'm seeing additional hands. Awesome. We could color that in green.
Right. And the final one is to inspire others to make PrEP more widely available. Yeah, were you inspired?
Were you inspired to make PrEP available in your own country? Okay. Yes, that one is inspiring some responses too. Okay, awesome. So I'm excited. I'm very, very excited because we've been able to meet almost all the expectations that persons indicated that they wanted to have met at the start of the session. I know monitoring is always a little bit touchy, and so maybe we could expand or find an opportunity to bring to you better understanding of how that part works at a later point. The Knowledge Management Technical Working Group and the broader PANCAP community has made note of that. That expectation needs a little bit more fleshing out. But thank you so much for participating in that. I'm going to ask everyone to turn your cameras on if you have one. Timothy would like a group shot. Yes, we can still do group shots, even though we're not posing with a fancy banner on the balcony of a hotel in Trinidad or the Bahamas or elsewhere, as we would much prefer to be, right, Dr. Singh? But we can still take a group shot. So if you turn your cameras on, if you have one, we could do that for about a few seconds, and Timothy will tell us what he wants us to do for the group shot.
That's it, thanks a lot.
Hey, Desiree.
Okay.
I'm smiling, I'm at the front.
Just 1 second, everyone. Just do another one. Just a second. Yes, thank you so much, everyone. Thanks a lot. Thank you.
Awesome. Thank you so much, Timothy. All right. So we've been able to bring you a morning packed with information. We had knowledge cafes from Dr. Rambaran and Dr. Forbes, and we were able to experience Dr. Rambaran's close-up as she shared with us what it takes to become published. And so at this point, I want to invite Dr. Adams, our PANCAP director, back to the forgive me. I do have the survey first. Please forgive me, Dr. Adams. Let's take the event survey. We're going to do a quick survey of the happenings today. And then right after, we'll take Dr. Adams. So, Dr. Singh, tell us how the survey is expected to work, and we'll take that now. And beyond that, we'll take Dr. Adams.
Yeah, thank you, Xavier. I think I'm having a little glitch at my end. Timothy, can you check to see if you can launch the poll?
Sure, one moment, everyone. One moment. It should be there now. Is everyone seeing it?
Yes, we are. So there is a survey on your screen. Please take a few seconds to complete that. Whilst you are completing the survey on screen, 3 quick questions. We will now invite Dr. Rosamond Adams to bring us the closing. Dr. Adams, over to you.
I think Dr. Adams is speaking, but I'm not hearing him, Xavier.
Okay, I'm not hearing him on my end either. So let's see if we could fix that audio challenge for him. Dr. Adams, are you able to hear us?
Rosamond, you may need to disconnect here. If you have earphones in, just disconnect and reconnect again.
While we wait for Dr. Adams, I trust that by now everyone would have completed your on-screen survey and hit submit. Shanti, are you satisfied that enough participants have responded? Timothy?
Rasman, Xavier, I am not seeing the survey. I think
Could we just give persons about 30 seconds more? Xavier and Dr. Singh, I'm still seeing some persons responding.
Okay.
Yeah.
Let's just give them a little more time. The numbers are changing. Just a little more time.
Awesome. Thank you very much, Timothy.
Yes.
In the meantime, let's work on Dr. Adams's audio.
Are you hearing me? Good morning.
Yes.
We can hear you, Rosamond.
Okay, great. I had to disconnect and connect again. Right. So as I was saying, and I don't think you heard anything that I was saying, but I was saying that on behalf of PANCAP and the team at the PCU, we're very grateful that you're able to participate in today's share fair. I think that we had very good presentations by the presenters and very good discussions. I think the overall sentiment in the groups were that there was not sufficient time for the presentations and for the questions, but it really showed the interest that this topic has generated. The objectives that were set out in terms of understanding where countries are with the implementation of PrEP, what are the challenges in the implementations, what are some of the reasons why people are hesitant, and so forth. I think that we were able to discuss some of these, and we were also able to share information as you go from hearing from Dr. Rambaram and hearing from Dr. Forbes on how they were able to implement, how they were able to address some of the challenges and even some of the existing challenges that they still have, and what they plan to do in order to move to support the scaling up of PrEP in the countries. I'm sure that all of us do want PrEP one day to be implemented across the Caribbean in a widespread manner. But it's going to take time, and it's going to take these types of sessions that we do in order to understand, where are the gaps and what we need to do more, and how we can support each other in moving these initiatives ahead. So I thank everyone for participating. Again, thanks to the presenters, very good presentations this morning, and also thanks to the Shanti and Timothy again for coordinating another successful virtual Share Fair session. Over to you, Shanti.
Thank you very much for that, Dr. Adams. All right, guys, and so that's where we leave you today. Thank you so much for spending your morning with us. We hope you found the information we presented today very, very useful, and that if you need additional information, you'll reach out to us at PANCAP or reach out to Dr. Forbes and Dr. Rambaran, and I'm sure they'd be more than happy to assist. So until next time, folks, take care.
Thank you, Xavier. Thanks, everyone.
Bye, everyone. Have a good day and weekend. Bye-bye.
One, be safe.
Bye.